spread of the virus. The aim is to minimize the spread of COVID-19 during the upcoming holidays and when the winter season arrives and more people head indoors for good. Joining me tonight in our 7 Up Front segment is the director of the CDC, Dr. Robert Redfield. Dr. Redfield, thank you for being here. Let's begin with those new guidelines, particularly as it relates to masks. Is this continuing to evolve because we're learning more and more about the virus?
That's right. I mean, I think it's very important that as CDC puts out guidelines, we base it on data and science. And with these new guidelines on masks, first, it's very important for everyone to realize that masks work. They really do can prevent the transmission. Earlier data showed clearly they could control the source. So if you were infected and you were asymptomatic and you wore a mask, you wearing a mask could protect others. And now the newer data shows that they also can provide protection if you're not infected, but you wear a mask and someone is infected in the room, it can actually protect you also. So there's bidirectional protection. I think the most important thing to take home from it is that masks work. They're the most important, powerful weapon we have. In order for them to be effective in containing this outbreak, as we see the surge across the country now, we need not just 50% of people to embrace masks, not 75% of people. The truth is this virus is more infectious than flu. And for masks to work in terms of stopping community spread, we really do need north of 95% of people to embrace masks, social distancing, washing their hands, being smart about crowds. And the other area that we think is important to begin to really operationalize is what I call the strategic use of testing to try to identify the group that's actually now driving this epidemic north that we're seeing across the country. It's really been spread now largely by what we call asymptomatic carriers, or the silent epidemic. And in order to begin to identify that silent epidemic, we need to use strategic testing, particularly in the group age 15 to 30, to identify these asymptomatic individuals and pull them out of the transmission cycle.
Dr. Redfield, what do you say to naysayers, whether it be family, friends, work colleagues, who even months into this pandemic simply don't believe the numbers or that the threat is as real as officials say it is?
Yeah, I think it's really important. And I congratulate you to have this conversation today, your governor today. It's really important not to underestimate this virus. The threat is really real. A number of us were saying back in September that we were on a course to get up from 30,000, 40,000 to 100,000, 150,000, maybe even 200,000 cases a day, and then see the increased hospitalizations a couple of weeks later, and then unfortunately increased death. This is a very serious threat. I don't think it's unlikely in the next week or two that we won't be having 1 million cases a week in this country. Clearly, we're likely to see significant more deaths. This is why it's so important now that everyone embrace these mitigation steps that we talked about. The other thing I want to emphasize, because it comes up with our guidance for the holidays and what your governor has talked about, the major mode of transmission right now in our country is different than what it was back in March. The major risk right now is not the public square. The major risk right now are family gatherings, small family gatherings. And that's why we're seeing this community transmission, as mentioned in your lead up. It's not the big cities now that we're only worried about. We're seeing transmission, significant community transmission in rural counties throughout, the Midwest and Upper West, and now in resurgence now we're seeing in Texas. So it's those small family gatherings where people let down their guard, take down their mask, forget about their social distancing, and that's what's really driving the transmission cycle right now.
No one wants to see our economy shut down again. But if we can't control the spread, are more restrictions going to be necessary in your view, for instance, with restaurants and bars, especially as the cold weather settles in places like Michigan here in the Midwest?
Yeah, I think we can be smart about how we use mitigation steps to keep the economy going. There may be some aspects that need to be curtailed. For example, I don't think it's healthy at this outbreak right now to have a bar that can maybe fit 50 people, have 100 people in it, all drinking without masks. I think that needs to be addressed. I do think you can look at restaurants that can maintain social distancing, so you may limit the number of individuals at this point. I do believe, however, that institutions such as schools, K through 12, we've learned how to do that safely. A lot of people were concerned, but we really have opened the schools in a safe and responsible way. We have seen cases in teachers and students, but when we trace them, they didn't come from the schools, they came from the community. So I know you are going to be going back to virtual learning, I heard, but there are ways to continue face-to-face learning in a safe way. So I do think, to answer your question, it's got to be thoughtful, but I think if there's an aggressive acceptance with vigilance of the personal responsibility issues I said, wearing a mask, social distancing, avoiding crowds, washing hands, using strategic testing to help identify the silent epidemic, I think we can do this and keep our schools open, keep our worships open, keeping our business open. There will be some selective businesses that pose a risk that we can't mitigate, like I mentioned, a crowded bar where no one's wearing masks. But I think we can balance this, and I think we should be thoughtful as we introduce any type of curtailment. I think, keeping the economy going, we can do it in a safe way, but it is going to take really full cooperation of the American public to accomplish that.
Well, and hopefully the vaccine is coming sooner rather than later. President-elect Biden has established his coronavirus task force now. Given your experience since March, what advice would you give him in terms of the first things to address moving forward?
Well, I mean, this is the greatest public health crisis this nation has faced in more than 100 years. And while there's many critics, I'm proud of the response that we have collectively done to begin to confront this pandemic. When I was first briefed in late February, early March about what our modelers at CDC thought was coming, they presented data to me to suggest that we'd lose 2.2 million people before September 1st. While it's tragic, at that time we'd lost a little less than 200,000, many important lives. This virus is now set to continue to unfortunately cause mortality in the weeks ahead. What I would continue to advise is that, we got to stick to the data and science. We've really got to appeal to the American public much more, I think, effectively than we've been successful to date on the importance of their own individual responsibility as being one of the key individuals in this fight that can make a difference of whether my mother gets infected, your mother or grandmother gets infected. We need to get the young people from the age 15 to 30 really engaged as warriors in this fight against COVID and figure out how to be more successful so that they're all embracing face mask and the social distancing, being smart about crowds, deciding to eliminate bars at this point in their life. I think those are the critical areas.
Well, and hopefully your words amplify that for all in our audience. Dr. Redfield, we want to thank you very much for your time tonight and for the insight here as we continue to fight against this pandemic. Thank you, sir.
Yep, thank you very much. God bless.